they have no role, in the onset of cancer in their lives. Another very important thing we must note about cancers in children is that there is no screening method to detect whether a child is going to have cancer or not. You may do pap smear, you may do breast cancer examination for adults, you may also, for the male, you can also go and screen for prostate. But in children, there is no screening mechanism to detect whether or not a child is going to have cancer. That tells you that cancers in children is even much more of a bigger problem than you have in adults, because there are some children who cannot even express themselves fully, so they do not know exactly where their pain or their problem lies. It becomes imperative, therefore, that we must make concerted efforts to be more proactive in detecting cancers in children. For instance, you are asking what are the common types of cancers in children. One of the commonest types of cancers in children is retinoblastoma. I think that's what we are beginning to observe, in most of the facilities around Abuja, that most of the children that come for treatment have retinoblastoma. A couple of them also have nephroblastoma. It's also very common there. There's cancers of the brain. We're beginning to see that very common now amongst children, in this part of the world. So it is becoming more and more prevalent, whether it's because of increase in awareness, or there are some lifestyle changes that is exposing these children more to cancers, is hard to tell. But the point to be noted is that we are beginning to see more and more children presenting with cancers in the hospitals. The unfortunate aspect of all of this is that they present mostly at the late stages. So treatment becomes more difficult and more expensive. And the chance of survival also, becomes slimmer, as the disease progresses in these children. I can understand I really can understand how painful it is for the pediatric oncologist to handle these children, because you see children present at late stages and they wish they would have been able to do a lot more to save these children, but because of the presenting stage is difficult for them, so their chance of survival becomes very slim, and it makes almost a mess of all their activities, because you do so much and then the chances of survival becomes very slim. Bearing in mind already that survival rate for children in low and middle income countries is about 20%. Now you see that if they present late, it becomes more difficult for them to even survive. Whereas in other climes, survival rates are much higher.